Thank you for allowing us to record today.
Yeah, of course. Okay, I am showing my screen. And it looks like I need to hide that and that. Okay. Thanks everyone for having me here today. Just want to give everybody a brief heads up. Came back from midwinter with the flu, which then got into bronchitis. So you may notice I sound a little scratchy. Hopefully I won't cough during this webinar, but I'd like to apologize in advance if I do. So as Louise said, I'm the Community Engagement and Outreach Coordinator here at the Greater Midwest region of the National Network of Libraries of Medicine. How that matters to you guys is we're situated in Iowa City, Iowa, at the University of Iowa. We serve a 10-state region, which includes Illinois. So all of the resources and things I'm going to talk about today are things that we have available that we can do to support Illinois libraries with their health programming and outreach and that kind of thing. I cannot see the questions window while I'm presenting, but there are going to be a couple points where I usually ask you for audience participation. So go ahead and type in that chat box, and maybe we can have Louise read some of those out before we move on. I'd like to have you guys be a little bit engaged at least. I know sometimes that's hard with the webinar. Okay, let's get started. Talk about public libraries and healthy communities. First, I want to talk about healthcare today and sort of why this matters and where things stand. So the first thing is that patients are expected now to be more involved in their health care and make decisions about their own health issues. So healthcare has really changed. Part of this is due to the ACA, and part of it is just due to changes in the system, whether it's insurance, the medical system, things like that. But you know, it used to be you go to the doctor, you'd be given your diagnosis, and the doctor would say, okay, and here's how we're going to treat this. Today, we're expected to understand our diagnosis, maybe be involved in the decision making about what's going on with our health, maybe be asked to be proactive. And of course, I'm sure you've all seen the studies and the research that shows how little time we get with our doctors. So you know how important it is to be prepared when you go in, to have the questions and make sure you're getting the right answers. Oops. The search for healthcare information. So the internet, of course, has changed a lot of things. The search for health information is one of those things. Healthcare, a recent study from Pew showed that health is the second most popular subject of an online search. The only thing that's more popular is just local community events. So these are really personal things that people are searching for. And unfortunately, we also know that 8 out of 10 online health inquiries start at a search engine, not with an authoritative source. And less than a quarter of the people doing the searches verify the date or the source of the information that comes up when they do that search engine search. As you guys know, probably Google customizes your results to your search history. People pay for rankings, that kind of thing. You may get an ad as a search result. There's a lot of problems trusting the search results you get from a search engine search. And we still know that there are a lot of people who don't have access to a computer at home or high-speed internet at home. My parents here in rural Iowa, their internet, I think, is about 5 megabytes per second. It certainly isn't high-speed internet access, and so much of the current health information is online. We also know the other problem isn't necessarily that people don't have enough information, but they're drowning in the information they encounter every day. That could be information they see on television or hear on the radio as advertisements. It could be in magazines or newspapers that they're reading. It's not necessarily always clear that they're advertisements. It could be the advertisements that are following them around the internet. Could be from their helpful aunt or uncle on Facebook, you know, that cousin that's doing the thing, you know, those kind of things. So it's not that people don't have access to the information, it's that they're drowning in information that's probably not high quality. I'm sorry, excuse me. And research shows that 9 out of 10 adults do have difficulty encountering that health information using the health information that they encounter every day. So I want to talk a little bit about what that looks like. And a lot of this is probably tied to digital literacy or media literacy, those kind of things. This is one of my favorite ads to show, Cialis, and I'm sure everybody on the webinar is familiar with this. When I give this presentation in person, I usually joke that I'm not sure what your foreplay looks like, but mine usually doesn't happen in two separate bathtubs on a hillside overlooking the ocean. But I guess Cialis can do that for you. This is a nutrition label. It's a sample label for mac and cheese. And one of the things that we know about people is that they struggle to understand nutrition labels and understand how much of different types of things they're supposed to have and what a serving size actually looks like. So those of us who've been going to the grocery store for several years might remember when the bags of potato chips did not say family size on them. That's a new thing that seems to have happened as a response to people maybe not limiting their intake of things like potato chips. These are also one of my favorite headlines to share with you guys. This one was making the rounds on social media a couple months ago. So great news, a glass of red wine is equivalent to an hour at the gym. You no longer have to go home and put on your workout shoes and your yoga pants or your sweatpants and head out. Instead, you can just relax in your living room with a glass of wine. And guess what? If wine's good for you, it turns out vodka might be even better. So, you know, we see these headlines that maybe start to sound like they're too good to be true. So we want to start thinking, hey, you know, what is happening with this information? This one recently went around, and I actually dug into this one. So this was actually going around about a month ago, about the time I was coming down with the flu. And it says drinking tea and wine can help keep the flu at bay. So I went into this article and I clicked on the link to the research that it was linking to. Here's the research that resulted in that headline. Now there's a lot of information on this page. I don't expect everybody to know what all of it means. I'm not sure I do. But I can see what it says, what that big arrow is eat more plants for influenza resilience. And so actually what they found is that flavonoids is what helps helps you be resilient to the cold and flu. And almost all fruits and vegetables and herbs contain these things. And they can be found in like other food sources like dried beans, grains, black tea and green tea. So the idea is that you can get these, what you need to help fight the flu, a lot of ways, but the headline went with wine because, you know, that's what hooks us. We don't want to be told that we have to eat the maybe not so delicious sounding food or drink the delicious sounding thing, but we want the easy way to do stuff. But people see these headlines and, you know, they don't dig any deeper. Let's see. Okay, and so now let's talk about real fake health news. And so what I've just showed you are headlines that are, let's call it based on a stretch, that maybe they're tied to what's in the story, but it's not necessarily exact. But in this case, this is actually fake news. In this story, someone created a study designed to show that chocolate helps you lose weight, and they only put in 5 men and 11 women, and then they had one group follow a low-carb diet and another one do the same low-carb diet plus a 1.5 ounce of dark chocolate. And then there was a control group. So out of 16 people, there was 3 groups. So that's a very low number. And the control group was instructed, of course, to make no changes. And they weighed themselves every day for 21 days. And they found that the chocolate eaters were losing some weight. But the problem is they measured a large number of things about a small amount of people. And when you do this in research and statistics, you're almost guaranteed to get some statistically significant result. So the whole study was sort of set up to trick the system, especially if you don't understand how research is done and should be done. But basically, it's along the lines of the more tickets you buy, the more likely you are to win. So they didn't really know, so they weren't necessarily measuring chocolate versus weight loss, but instead they were looking to say, what does chocolate do? And so that headline could have also been, chocolate helps improve your sleep, it helps lower your blood pressure, things like that. But they looked at all these different things. So then they took this and they submitted it to 20 journals, and they had multiple acceptances within 24 hours. And then they did a big press release with a fancy headline, something like, "We like to see like chocolate helps you lose weight." And it was just picked up almost immediately by multiple news sources. And what's interesting about this is that if anybody had dug deeper into that, it was fairly easy to see that this was a bad study. But most of the time, our science reporters and our health reporters don't have that expertise or aren't using it sort of in the rush to create headlines and get clicks. Okay, so one solution or one way to target and deal with some of these things is health literacy. So what is health literacy and why does it matter? So I'm going to have you guys put this in the question chat box. One out of how many American adults reads at the 5th grade level? Go ahead and, oh, I'm sorry, yeah, go ahead and put that in the question box. Let's see if I can pop out here. Give me your best guess. 7, 4, 2, 5. Oh, good job, guys. Okay, let's pop this back in for a minute. 1 out of 5. So that's quite a few. It's a pretty big number. And then here's your next quiz. Americans, on average, read at the 8th to 9th grade level, and yet most healthcare materials are written at the what grade level? And again, go ahead and put that in the questions box. Yep, the 10s have it. Oops. The 10s have it. It's the 10th grade level. So accessing good health information is really important, and having it written at an appropriate level is really important. So what are we talking about when we talk about health literacy? This definition comes from the Department of Health and Human Services Healthy People 2010 plan. The 2020 plan is out now, so if you're looking for some updated information, that is out there, but the definition hasn't changed. And essentially, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate decisions about their health care and needs. So there's some interesting things we know about people with limited health literacy. They're more likely to end up in the emergency room. That's because sometimes they don't get preventative care. They wait too long, and instead of, say, going to their regular doctor, they go to an emergency room, which is more expensive for them and the institution providing care. They have more preventable hospital admissions. So say failing to get routine checkups or going to the doctor early. Instead, they wait until something is serious before going in and then are admitted to the hospital. Again, that costs them money and the hospitals. They're more likely to skip routine tests. So, the annual tests that we get every year or every 3 years, or, as we get older, the additional ones we're supposed to start having, they're the more likely to skip those tests. They struggle more to manage chronic diseases, in part because they have trouble understanding the information provided to them about those diseases. And they're just less likely to adopt healthy behaviors, say going for a walk at lunchtime or trying to eat more fruits and vegetables, those kind of things. They're less likely to act on important public health alerts. So things we saw this year about getting your flu shot, things that were happening, a couple of years ago with the Zika, well, I guess it was really just a year ago, with the Zika scare and the things that you're supposed to do to help prevent the spread of that, especially to the fetus. They're less likely to use preventative services. So again, this is how they end up in the emergency room or hospital admissions, or do the screenings for things that we need to get screened for. Misunderstand prescription labels or instructions, and this is really a lot of people. When we talk about limited health literacy, again, it goes to that like 9 out of 10 adults have trouble understanding the information they're encountering. So this is really a high number of people. And poor comprehension of nutrition labels, which I already talked about. So there really is a wide range of costs. So we also know a couple other things. They often don't understand privacy issues around health-related technology, whether that's an app that's on your phone or fitness trackers or something else, say they might be using online. So there are some diagnosis tools out there where you can, or symptom checkers out there, and often those contain ads which can follow you around the internet. Some of those sites want you to sign up and provide some personal information. They also may feel ashamed and try to hide it, especially when they're interacting with the librarians. People tend to think they're supposed to know these things and are afraid to say when they're not understanding what's being said. So who tends to be affected by this the most? Adults over 65 years of age, racial and ethnic groups other than white, recent refugees and immigrants, people with less than a high school diploma or a GED, people with an income at or below the poverty level, and non-native speakers of English. So these aren't the only groups affected by this, but these are the groups that are most affected by this. So let's talk a little bit about how libraries can help. We know that 62% in their communities, that 62% of public libraries are the only provider of free access to computers and the internet. And again, I mentioned often the most current health information is online, and it's the easiest way people have to get that information. And at the same time, we know that only 24% of public libraries offer classes on how to access health information online or how to do health information searches online. So there's a pretty big gap there and plenty of room to grow. So the first thing you're going to want to do if you're interested in start offering health and wellness related programming and outreach is assess the health of your community. This tells you what the problems or issues are in your particular community. It also gives you a starting point for partners that you may want to work with. So there are a lot of ways to do this. You can start by searching at the Kaiser Foundation State Health Facts, and that's going to let you click down by state down to county, and it's going to give you a bunch of different information, health costs, budgets, insurance, health status, those kind of things. Similarly, from the Robert Wood Johnson Foundation, there's the county health rankings and roadmaps. Same thing, you just click through and find your county and you'll get that information. A lot of this is copy and paste type information. It's really good to use if you're applying for a grant or something like that. Your local state health department may have some information for you. In this case, I used Wisconsin, but they're a good source. And your county website or health department may have some good information available for you. One or more of your local hospitals also may have done a community health needs assessment. These are required under the ACA Act that all, I think it's 503 hospitals perform these, and 501c3, I'm sorry. Hospitals conduct a community health needs assessment. And so they're supposed to do it at least once, at least every 3 years. So this may be the most specific to your region. Depends on the area that the hospital serves. So this is one here in Iowa, and you can see that it actually serves a 5-county area. So that's why you might want to say go back here in Iowa City, we're in Johnson County, and look at the county specific things. So you have a lot of options for exploring this, but also as you do explore this, make note of who else is already doing work. Is your city health department or your county health department, because those could be good starting places for community partnerships. Okay, so the reference interview, I don't talk about this in depth in this class, and I think most of you have been, if you work the reference desk, you tend to know what you're doing. But sometimes the health reference interview can be especially challenging. So this is another one where I want you to type in the questions box and go ahead and share some challenges that you run into or that the patrons run into while answering health-related reference questions. And I know some libraries have dedicated health sections, and some of them it's in with the regular collection. So where and when you encounter these questions can vary, but yeah, if you just want to type in maybe some challenges you have or some challenges you think the patrons have when asking for health reference questions and share with the group, that would be great.
Bobbi, would you like me to read some of these, or can you see them?
Somehow I'm missing them. I'm
okay.
That's okay.
I'll read them. So Patrons don't know when things are an advertisement. They don't remember the exact thing they were diagnosed with. Some patrons do not want to divulge what they have been diagnosed with. Some patrons just have very little knowledge of medical terminology. Some patrons only search Google and don't know that there's other resources available. Some patrons do not know what they're looking for, so they need to be a little bit more specific. Some people expect library staff to be doctors and medical experts. Some get a little too personal as the conversation goes on. Some want health advice over the phone. And that's the last.
Okay, yeah, these are all great. Oops, let me pop that back in. So one may be that they're not familiar. So these are just a couple that, having done this talk a couple times, I hear a lot. So not being familiar with resources, that might mean them. So they're just searching Google. They don't understand that the library provides access to, say, subscription databases, or has a link on their website to something like Medline Plus, which is evidence-based medicine. Same thing, you may not be familiar with the resources. Depending on the situation, you may not get asked health questions very often. It's not necessarily a fun part of the collection to be in charge of or be super familiar with. And just because you're not encountering those questions with frequency, you just don't know them as well. Medical terminology, this can be complicated for both you and the patient or the patron. Maybe they went to the doctor and they were told they have hypertension. They don't understand that that's high blood pressure. The doctor didn't write it down for them, or they didn't bring in the piece of paper with them when they came into the library, and something's lost in translation and they're not saying hypertension anymore, they're saying something else. You're not a medical expert, and so you're in a situation where you don't recognize the term they're using, and you wouldn't want to guess either, right? So this can be a barrier both ways. Knowing how much to ask. Sometimes people just want to be pointed toward the health section of the library or the health section of the website. You run the risk, of course, of getting too much information when you are looking to help somebody with health-related reference questions. You don't want them to feel like you're invading their privacy or asking them for too much personal information. Using open-ended questions can be a plus and a negative. People may be reluctant to share information with you. They may divulge way too much. You may get to see somebody's rash, that kind of thing. Not offering personal experiences. I think most of us join the library profession because we're empathetic and sympathetic about a lot of things, and it can be very tempting to offer a personal experience as a way to show sympathy or to relate to someone, especially if they're upset, emotionally distressed. It's really important that we don't do that. And these interactions can be uncomfortable for a number of reasons, right? Somebody just showed you their rash, their funky toenail, they're sharing, they're emotionally upset because they've got bad information. You're not comfortable answering health questions. You're not sure how much to ask. And so there's a lot of things that can run into this. And just want to point out that we offer multiple courses on this type of thing. So I'm not going to go too far into that today, but if there are options out there, if that's something you're interested in exploring more. I do want to share with you some of the resources that we offer. We offer a wide range of resources, so I'm just going to touch briefly on 2 or 3, no, I think about 4 today. If I can switch over to my web browser. Okay, here we go. Here are a couple things I opened up before we got started. So if you want to take away one tool from us today, I recommend Medline Plus. This is evidence-based health information. It's ad-free, so you're not being followed around the web for the things that you look up. What you're searching for here isn't going to show up later on Facebook. when you're looking at things like that. So there's a couple things I like to show people about Medline Plus. One is just the health topics. So if you're, say, looking for information about a condition or a problem, you have a couple options. And you can just search by, say, system or part of the body. So let's say you know you have something wrong with an ear. You can go to this ear, nose, and throat page and click here. It's got a diagram, which is very helpful depending on communication situation. And I'm going to click ear. And now you can see quite a few things have come up with ear problems. So tinnitus is when people get the chronic ringing in their ear. I click on that for a demonstration. And this is what a page for any type of health topic looks like in Medline Plus. You have some very basic information. Start here with sort of what can cause this. You'll see down here further, start here. Sometimes these link out to other resources, but one of the great things about Medline Plus is that these have been actually vetted by somebody. They're not just a collection of links that were thrown up. So anything that you see linked to, say here from the American Academy of Otolaryngology, has been vetted by someone. You can see prevention and risk, treatments, living with, clinical trials, and some journal articles if you're interested in that. Finding an expert down here might help you find a doctor or somebody who can help you with this condition, and then some additional information. So for example, for children, can loud noise hurt my ears? This information is also available in Spanish, so that's a great as well. You can look at the medical encyclopedia over here on the right to learn more about this. Oh, and my favorite thing, and I think probably the most important thing about Medline Plus is when you're, say, showing this page to a patron, if you click this link here to print, so you want to click the printer icon on Medline Plus itself, it's going to, give me an option, full topic plus links. I want this preview to come up because it prints these out. And so here, this noises was a hyperlink. And you see now it's got the whole URL spelled out in the printout. And it has done that for everything that was a hyperlink on that web page. It automatically does it for you. So this can make a really great resource to give printouts to patrons. Now, these links are obviously not something I would want to type in, but we know that people often, especially older people, still prefer print. Okay, let's go back here. The videos and tools, sometimes there's health videos that just show, these can be good for homework assignments or things that the kids are doing or people that want to watch a video to understand. It also includes things, if you saw on the first page I was at, surgery videos. So if you're the kind of person who, say, is having knee surgery and wants to watch a video of that happening first, you can go do that. I'm going to confess, I am not that type of person, but this is your thing. Here's a good option for you. We've also got some health check tools, games, and that kind of thing. So one resource, I think, if you take one resource away from today, I think that Medline Plus is it. I also wanted to show you there are two specific pages. One is for teens, so I just went to the topics and T for teen health. And if I click on this teen health link, this is a page written for teens, not about them. So this might be a page you say want to link directly to from your website or have bookmarked and readily available. So you can direct people to that. And the patient handouts just lets you get some information. In this case, it's not particularly useful. They have a similar page for children. So again, I'm going to go to C for children, and I'm just going to scroll down to child health. Oops, what did they do with it? Oh, children's health, there we go. Scroll further. Okay, same thing. This is a site that's just written for kids, not about them. So there's some good information here that you can share with them. Okay, then the next page I want to show you is the National Institute on Aging, and this is a website written for seniors, not about them. You might be sensing a theme here. So as you get, if you come to this page, you can see health information. There is a good section for caregivers. That's going to be an increasingly important part of what we discuss as the population ages. In this case, I clicked on a section on healthy eating. You can see that these pages are designed very cleanly, and there's no ads to distract people. There's not multiple columns for those who may be not as familiar with the internet and technology. So you can see these options, and it's nicely done with photos here too. You can order some free print publications here if you want to share those with your patrons. This is, I think, is a worthwhile one to bookmark as well. And then the next one I would like to show you is the National Center for Complementary and Integrative Health. And these are things like we're talking about complementary and integrative health. So you may have somebody asking you about herbs or acupuncture or acupressure, and this is where you'd want to go for that. So the first thing you can do is just explore what do complementary and alternative or integrative health, what do these mean, and you'll get some definitions and explanations here for that. I think one of the better or the more useful things on this page is herbs at a glance. So it's cold. No, we don't want to do feedback. Thanks, guys. It's cold and flu season right now. Well, we're getting towards the end of it, hopefully, but so I like to use echinacea as an example. You guys know what this is recommended for, right? In theory, it will help you get over your cold symptoms more quickly. So when you click on that page, you're going to get some basic information. This is the background, so it's going to tell you just some background information on it. If it was used by any other groups like Native Americans or other Native groups, what it can be used for. In this case, a dietary supplement for common cold, believing it stimulates the immune system, and it talks about the plant. So then it says, how much do we know? And in this case, many studies have been done on echinacea and the common cold. And what have we learned? Taking echinacea after you catch a common cold has not been shown to shorten the time that you've been sick. So sorry, guys. If you take it while you're well, you may slightly reduce your chance of catching a cold. So it goes into this sort of information about what the research shows. And then they also talk about what do we know about safety. So some people may disregard this and want to keep taking it anyway. So what possible side effects are there from taking it anyway? And you'll get that information here. So more links to more information, references, etc. at the bottom. But again, you'll notice this site is ad-free. Like anything, we've got information about being informed or how to make good decisions. Things, 5 tips you should know about depression and complementary health approaches. So these are good things to know or be informed of. Okay, and then the last research I want to share with you guys today is Health Reach, which is health information in many other languages. So there are a couple tabs here, but the one you're going to want is patient materials. And you can limit by language here, format of the content, and who the author is. You can also just do a basic search here and limit by language. So you'll get that information. Right here you can see at the, like a lot of us right now, they have put up a focus on opioid misuse on the homepage, and it's 22 easy to read. And these, in this case, these are English language handouts. But you'll often find things that are easy to read, which is the things that we want when we talk about health literacy issues. So here's the basics of opioids. Okay, let's get back to the PowerPoint. Oh, I just put some holder screenshots in here, which I'll go through really quickly since we covered all these. Oh, one more resource that I didn't show you guys, but you might be interested in, is the Medline Plus magazine. This comes out 4 times a year. It's a free subscription. If your library is an NNLM member, you'll automatically be signed up for this, but you can also order bulk subscription or bulk supply of it. Say you're going to be having a health fair or some other event and you want to give these out to people who attend. There are no ads in here, and they usually feature someone famous on the front cover. You can also go to our website to order additional materials. Medline Plus bookmarks are one that's there, I think is a great resource. The other thing that you can get from us are these because statement posters from the library's Transform campaign. This is part of a joint project between the ALA, American Library Association, and the National Library of Medicine. We worked up these because statements, if you're familiar with them, and we had them made into posters. You can order them from us for free, and they're 11 by 17, and we will mail them to you in a tube.
Bobbi, sorry to interrupt,
Yeah.
but we're not seeing your PowerPoint.
Oh, that's important. Okay.
All right, we're still seeing the website.
The screen, how about now?
There you go. Great.
Yep, okay. Let me go back real quick.
And there was a question about, is the magazine available in Spanish?
Yes, there is a Spanish version of it. It's called Salud, and I think it comes out 4 times a year as well. Yes. And so that is in the links. It should be in the links I sent you guys on how to sign up for those online. They also are available online, so you could link to them from your website. So that's Medline Plus. This actually happens to be a famous person on the cover, I knew, so I was kind of excited about that. And these are the Because posters. So I want to show you these to you guys because I was involved with these. This is a great initiative that was led by one of our other regions, but I got to partner in, and we did these beautiful Because statements. So if you're not familiar with the Library's Transform website, definitely go check it out. They have more shareable information you can use, like Twitter for Twitter badges and Facebook and that kind of thing. And then I want to talk a little bit about programming and outreach. So sometimes when I give this presentation, people either don't have ideas or are looking for new ideas. So I think a really simple one you can do is obviously a subject guide on your page where you link to information. This could be just general health information, or it could be just specific populations. And you can see the sample is for senior health. They linked to, this library is linked to some subscription services that they provide, as well as some things from the catalog. This is, I think, a really neat idea. So health and fitness kits, in this case, these look like some popular DVDs that can be checked out. I saw online the other day, one library was checking out weights and other, like a blood pressure monitor, those kind of things. These are a neat idea I heard about with the library. This Portage Library is doing these diagnosis bags. So you come into the library, say, and you are really recently or newly diagnosed with diabetes. This is the website page about that. And then this is the catalog record here. So this kit that people get to take home includes 6 books, a bag with straps, and then it gives the information that are here. Some of them, I looked through multiple ones of these. This one doesn't include any DVDs, but some of the other kits that they have available do include some videos for watching. Services for target populations. So Brooklyn Public Library offers some great targeted programs for older adults that includes lectures, films, performances, and educational programs. So there's just kind of a wide range of things there. This is just another programming and workshop, and here you can see children, teen, and adult, and the library offers health programs and workshops. This is the one that's a partnership. So in this case, the class is happening at the library, but it's the health department who's coming and talking about nutrition and portion control and things like that. So this is another great community partnership. The library is probably providing the space, but the speaker is from outside. This is one I like to highlight because we funded this. These are community conversations that are happening at the Westchester Public Library in Indiana. They started out, the first one they did was they showed the Frontline movie Being Mortal, and then they had community members come in and talk. So they had people from the hospital and the hospice and the senior care facility and some other groups come in and have these community conversations after they all watched the film. And I think Walgreens provided water and tissues for them. So they've had a number of follow-up conversations with that. Their first one was so successful. They do use Eventbrite to take reservations, and they've had a couple other ones about palliative care. This one is happening just this week, and they've brought in the speaker from Alzheimer's Speaks, Lori, to talk, and they're going to watch His Neighbor Phil, which is a movie about dementia and Alzheimer's. And I'm the one that evaluated the application for the funding for this. I'm going to tell you guys, I watched the preview of that movie. You're going to need some Kleenexes. Oh my gosh. I hope they got Walgreens to like give them boxes. And then they're going to have some conversations. These have been very popular in their community. They've also partnered with the Alzheimer's Association to do some things. This is a slightly different one. So this is a library is partnering with the Pima County Health Department, and they've brought in public nurses to just provide sort of basic services and conversation information in the library. So assessment, nutrition information, blood pressure screenings, outreach. Oops, go back. And you can see this got a innovator program from the Urban Libraries Council and some other awards, which was always nice. This is another great program, and we funded this one as well. This one we funded before I got here. Tales and Travels was developed by Mary Beth Reidner when her husband was diagnosed with dementia. And the way the programs work is it's essentially the idea that you go into maybe a center and you take a box of things that are all tied to a location. So there might be, let's say Ireland was the destination. There might be some picture books about Ireland, and those would come from, say, the children, the teen, and the adult section because there's different levels of information and visual stimulation with them. It also might include some physical things from that area. So maybe not with the Ireland example, but like if you were talking about somewhere tropical, you might take in some shells or those kind of things. Maybe things that have to do with native mythology and those type of things. And they've had really good luck with this program. And they actually did some studies that showed people who are involved with this type of programming were more active and stimulated. And as always, if you're not familiar with the Programming Librarian, which is a ALA website, there's some great information there if you're looking for ideas for programming and outreach. So how can we, the National Network of Libraries of Medicine, help your community? So one thing to keep in mind is that just because it says National Network of Libraries of Medicine does not mean that our only members are medical libraries. Anyone can join. Membership is organizational, not individual. We have lots of public libraries as members. We're divided into 8 regions across the country. You can see the green dot is for Iowa, but it is not where Iowa City is on the map. And we serve from North and South Dakota over to Kentucky. So that is us. We moved to this location about 2 years ago, and we've really stepped up our outreach to public libraries in the area. So what can we do for you guys? One is we have a wide range of resources that come from the National Library of Medicine, like Medline Plus or PubMed. We also support resources from the National Institutes of Health. We offer training for public libraries. All of our training is at no cost. We are funded through the government. So we can do in-person presentations and workshops. Some of you may have seen me at the Illinois Library Association in the fall. I was there doing a presentation. I'll be at PLA in a couple weeks doing a pre-conference workshop for about 75 people on health and wellness. And of course, like everyone these days, we also do webinars. And we also do asynchronous online classes. We use a software called Moodle to do that. Sometimes those classes take, say it'd be a 4 CE class and it'd take about 4 weeks to finish. The one I'm teaching right now is a 12 CE class, and it takes 4 weeks to finish. So the amount of time you spend on them is sort of up to you. We also provide funding. That might be for professional development related to health and wellness. And we also provide funding. We don't call them grants. They're not really grants, but they're funding awards for health-related programming and outreach. And our funding cycle, let's see, there's become a member. I've done this. Oh, I can't remember if I have this slide in here, so I'm going to cover this back here. Just want to be sure. Our funding cycle runs May 1st through April 30th, so our new awards are up on the website now. We'll start reviewing them, I believe, on April 1st. No fooling. So take a look at that. I talked about membership and training. So let's talk about a couple specific upcoming opportunities. I think the PLA pre-conference is still open, but it is just a couple weeks away. So I've already sent out the pre-conference. There's a pre-assignment that's already been sent out, but you have plenty of time to catch up. This is the class I'm teaching now, and we're going to be teaching frequently over the next couple of years. We received some funding to revise our course and create it specifically for public librarians, or public library staff. Right now I'm teaching it. There's going to be an April 23rd cohort and a July 9th cohort. It takes 4 weeks and you spend about 3 hours a week. You come out of it with a 12 CE certificate, and participants receive the Consumer Health Information Specialization Certificate from MLA. We fund the application cost for that, and it's good for 3 years. You can also look at our website. We have a wide variety of topics and classes available. And we will be giving the same pre-conference that I'm giving at PLA at ARSL, which is taking place in Springfield this year, if you guys did not know. If you don't want to take those in-person classes, or you don't want to take Stand Up to Health, we have some things that are address specific topics. So for example, this is just a short list, but you can see Caring for the Mind is a mental health information class at your library. We have another one for veterans, providing information for veterans. Food for Thought is really popular. It's about exploring information resources, nutrition information resources. We have one for information for teens, which they've named From Anorexia to Zits. Beyond Our Borders is taught by someone else here in my office. He always gets positive reviews, and it's multilingual and multicultural health information. Health issues in the headlines. So if you liked those wine headlines, you might get some more of that here. Healthy aging at your library, older adults, LGBTQ populations, K through 12 resources, alternative and complementary medicine, and then consumer health on the internet. And these are just some examples, but you can see there's a good range of classes. So the certificate I mentioned is from the Medical Library Association. It takes 12 CEs and the credits are free. It's good for 3 years. And we're going to sponsor that application fee for you. It's $75 to renew. Oh, here's our funding. It is regional, so you would need to apply to our region. Each region is in charge of their own awards, and like I said, the funding cycle runs May 1st through April 30th, so you'd need to spend all the money on your project by next April. If you're looking for ideas for programming and outreach other than, say, things that I covered today, or ideas for things to fund for projects, you can, on our website, explore our past funded projects. You can see this backpack program, and you can click on this to get a more detailed information about that. If you'd like to keep up with health and wellness information and you're a Facebook person, you can join this Facebook group. I am the administration for it, but I do it with several other people who aren't tied to the National Library of Medicine, so it's not affiliated specifically with us, but there's some good things there. It's called Libraries Are Champions of Healthy Communities. That's what you would want to search for, not this banner information. All right, and we have some time left at the end for questions, about 7 minutes.
Thank you so much, Bobbi. That was really informative and a lot of good information there. As Bobbi said, we've got a few more minutes, plenty of time for questions. I haven't seen a whole lot come in, so we can give folks a minute or two to type those in. There was one question about what is your website? Is it that nnlm.gov? Is that your website?
Yeah, our specific website is going to be nnlm.gov/GMR, and that should be on the handout that you sent out.
Yep. Yeah, right now the handout is actually in the webinar software in your control panel. There's a handout section you can download from there, but I'll also share it with the recording with everybody later on. Question just came in. If you could talk a little bit more about the Stand Up for Health classes, how do people sign up for that?
Yeah, so you have a couple options. We put out a call for applicants for our March cohort, which I am teaching right now. I'm going to share my internet again. For our March class, and we could take 75 people, and we had 228 apply. So if you go to our website, which is, and the link to training opportunities is again on that handout, you can go to training and see the training schedule. The next class is going to be the April 23rd cohort. We'll also be offering it on July 9th, and then an as yet undetermined fall date, probably late October. We're trying to get our instructors past, our instructors, that includes me, guys, talking about it like it's somebody else, past the fall conference season. So once we sort of know where we'll be at and where we'll be traveling in the fall, we'll get that scheduled. So you can page through these pages of information here for training opportunities. What I should have done is just say go to class descriptions. You'll go to it's alphabetical. We're looking for Stand Up for Health. If you click on this, it will show you the 2 upcoming classes. So there's one scheduled for April 23rd and July 9th. If you think you want to be in the October class, just send me an email. As I said, we had 228 people register. I put 75 into the March class, but all the rest of them I emailed and asked for their first and second choice for a later cohort. And so I'm keeping an Excel spreadsheet too. But you can also sign up online if you want to do that. So let's say you want to take it in July, click additional details. Here's the class overview. You do have to register to sign up for classes on our website. It's a fairly simple process. Username, email address. It will require just that it's checked against it being spam. But once you've done that, you'll need to do this to sign up for any class on our website. You can register. You'll get an automatic email from the system. If you have problems, just email me. Any other questions?
Let me just double check here. No, I think that's it.
Okay. Oh, and I meant to mention, you said tell you more about the Stand Up for Health. So here's where you can read a little bit more about it too, what's covered in each week, if you're looking for that sort of descriptive information as well.
Oh, I do have a couple more follow-up questions.
Sure.
Do libraries need to be a member of NLM libraries to take the classes?
You do not, your library does not need to be a member to take the class. The only place we would love you to join, of course, and that you'll automatically get subscribed to our listserv, which is a good way to stay up to date. But the only time we ask that you be a member to do anything with us is if you want to apply for funding. So if you're applying for funding for outreach programming or professional development, we will ask that your library be a member.
Okay. All right. And then lastly, what is your email address? Is that on the handout too?
Yeah, it's on the bottom of the handout. But it's just Bobbi-Newman@uiowa.edu. So once you get to our website, or if you go to, so the handout I gave you has a tiny URL that is going to take you to this page. Once you get there, there's my information. Now, my phone number is listed there, but I always advise that you email me because I travel a lot, and I check my email when I'm traveling, but it's much harder to check my voicemail.
All right. Great. Well, I guess oh, I've got one more question. Sorry. Well, this will be the last question. So, does your site address how to publicize consumer health classes at a public library, besides the usual flyers or, announcements on a web page?
So a couple of our classes address that. I don't know that our site has that on there, but the Stand Up for Health class, the final week talks about programming, and it tends to talk about partnerships as a strong way to do that. And we have another online class called Activate, Collaborate, and Educate. ACE is what they call it. And one of the nice things about our classes is most of the time the course material is on here for you to download, and you can see that the last time it was updated. So this is just the PowerPoint. You're not getting the whole experience, but you might get some helpful information by looking through here.
All right. That's great. Well, thank you again, Bobbi, for your time today and the helpful information. We really appreciate it. And thank you all for participating. Bobbi did give us permission to record, and so I'll be processing that and sending out a link to everybody within the next day or two. So thanks again, Bobbi, and enjoy the rest of your afternoon.
Thanks, you too. You guys have a great day.
Okay. Bye, everyone.
Bye.